I think it's right that there are concerns about the use of cannabis with patients who've had a prior history of psychosis, and it's really important that we know that they have a history of psychosis and that we fully explore what that was for them. I think that there is a role for cannabis with psychosis, but it's always about tailoring it to the individual patient. We have to be aware of their symptoms, we have to provide very high quality care and monitoring, and I think we're able to do that safely within the clinic. I think there's a role for medical cannabis to meet lots of needs of my patients that I work with. So lots of the things that people would come to me and want support with can potentially be treated really, really well with medical cannabis. There's a lot in the media about the negative sides sometimes of taking medication, so I think cannabis is a different way of treating their illness that's really appealing to some people. I've seen medical cannabis really improve quality of life in a huge range of ways, depending on what people have come to speak to me about in the first place. In terms of offering treatments for PTSD or anxiety or mood disorders, then cannabis can have a huge role to play. I think for lots of people it's about giving them an additional choice in terms of their treatment. It's about giving them a treatment that often they can use in different ways that suits them. So they might be using their cannabis by vaping or with an oil. And we know from the literature that there's a growing evidence base for how effective cannabis can be to treat a whole range of symptoms and diagnoses. And I really think that we should give people also all the options always. So for me, cannabis should be one of those options. And a lot of people are really, really intrigued to try it and find that it works really, really well for them with very few side effects. So the way that I would work with patients to make it a positive experience for them is always about collaborative care. So it's first of all about really listening to why that person has come to see me. So hearing their story, hearing all their worries, hearing their concerns. And then it's about working together, not me telling them what to do. It's constantly checking in, having lots of support around, having regular reviews, and really for that person to know that they're leading their care, which I think can feel really empowering. The future in terms of using cannabis with mental health is really, really exciting, and I think that this is an unprecedented time in terms of really high quality research that is going to shape the way that we prescribe cannabis, and also going to offer a whole new range of choice for treatment for patients. And I'm really excited to see how things evolve over the next few years, which I think they will do hugely.